It was a very rigorous program, certainly, as medical school was then. Some of the courses were kind of boring. Biochemistry was pretty unimaginative, although it was a very strong biochemistry department. But I remember having a little bit of the same feeling that I had in my freshman year in college, that you were sort of doing a lot of rote learning about lipids and so on, and the laboratory exercises were not particularly interesting. I think that's changed considerably. One of the things that was good at Columbia was one had a very early access with patients. So I think even in our freshman year, we were already in the outpatient clinic with a mentor. That's where I guess I think bacteriology would have been that first year, and one of the things at Columbia that was a little bit unusual was the strength of the immunology training there. Elvin Cabot was the senior person there, and so we had quite a strong academic training in microbiology in general, but in immunology in particular. And I think that must have started my interest in that. And then I think otherwise it was a pretty routine medical school experience, except that, except for the first summer, it was a full year-round program, which was a little bit unusual, I think. And so one of the electives was to do a research elective. And that's when I did my first real research with a woman named Beatrice Siegel, who was a tiny little woman, very sharp, the wife of a very florid David Siegel, who was at that time director of Goldwater Memorial Hospital, where the new facility of Cornell is going to be going on Roosevelt Island. And she, at that time, one didn't have biosafety hoods and so on, and so one learned how to deal with keeping things sterile by just very good technique, and one learned that with her. And so that was a very, very good experience. I really enjoyed that.
So then your time as a resident was strictly clinical.
Yes, at that time, this was between the wars, between the Korean War and the Vietnam Wars, and there was still the draft, the doctor's draft, and one could get a deferment for 2 years of clinical training, a year of internship and a year, what was then called a year of internship, and a year of residency. So I had an internal medicine internship and a year of internal medicine residency. And then one had to serve in the uniformed services, and one of the uniformed services was the Public Health Service, and one of the units of the Public Health Service was the NIH, and if one could get a position there, that was good. I should mention, since you asked about medical school, I think one of the certainly major influences in the medical school was the head of internal medicine, who was Robert Loeb, whose father was Jacques Loeb, who was the great reductionist. And Robert Loeb had been trained at the Hopkins and was one of the early and outstanding physicians who recognized the importance of getting laboratory data and of hard data to make clinical decisions. And so that was one of the major influences in those of us who trained under him. He was a terrific physician also with patients, but a very, very demanding person, and sometimes to the point that he could almost be a little bit cruel to somebody who didn't perform well. But if you performed well, he was very, very supportive, and as a house staff officer under him, he would have sunrise services before we went on the wards as intern, in which we would discuss all sorts of philosophical things. And he was reading at that time something that I just read relatively recently, which was the Essays of Montaigne, who was a very modern kind of a thinker. And it was just a tremendous experience, all of us who trained with Loeb.
How do you spell his name?
Loeb. Yes, since you asked that, when one presented to him, particularly as a medical student, one was very, very nervous. And there was the famous incident of one of our classmates saying that the pneumonia is in the right upper lobe, Dr. Loeb. It was in the right upper lobe, Dr. Loeb. So there were several instances like that.